Hi, welcome to Unwinding with Mama Mali, where we talk about the truth with no filter and embracing parenthood with all its imperfections. Today's topic is taking care of your hoo-ha. Disclaimer before I begin, I am not a professional. I have not done medicine. So everything I'm going to talk about is purely from experience and other people's experience. It does not matter the type of delivery, you need to take care of her regardless. The biggest misconception women have is CS over vaginal birth so that it does not expand on there. Well, I'm sorry to burst your bubble, honey. If you had a vag birth, you need to take care of your hoo-ha more. Even if you had that episiotomy or perineal tear, or if you did perineal exercise. Well, perineal is the area between the opening of your vagina and the opening of your anus. That's that small space in between. That is what I am talking about, and that is the place where you really need to take care of after giving birth, because that is the place that usually gets bruised the most. So there are 4 degrees of tear. First degree is just a bruise, no need of stitching. That is what happened to me, but I was stitched anyway, but it really wasn't necessary. Second degree tear, it's just the skin tears kidogo, and after delivery the doctor can just stitch it up and you're good to go and you'll heal after a few weeks. Third degree is when the tear goes to the muscle that controls the anus. As I said, that one I think will need to be done in the operating room and it will take longer to heal. Now, 4th degree is when I'm going to explain it as simply as I can. Is when now the whole thing tears. You see, the opening from your vagina to the opening of your anus, when the whole thing tears. A question that many women ask: will the vagina go back to its original state? The truth, it does not. So close to, but not at the exactly where it was. But it will only go close to if you take care of it. One item that I wish I had in my bag when I was packing for the hospital is a spray bottle. Because after giving birth, the steam, steam when you pee. And when you go home, have your eyes separate from the vituzanyumba, please. Another thing is wipes. Use alcohol-free wipes. In short, just use baby wipes. Don't use regular tissue. You can use cotton. Just soak cotton in water and wipe your hoo-ha. Another thing is maternity pads. Get maternity pads. Don't use regular pads. Number 1, discharge is not normal. Discharge is chafu zenye zinatoka after giving birth. After every 2 or 4 hours, change your maternity pad per day. I'm going to be as real and raw as possible. It is not the normal periods that you normally have. Hii ni mbaya, the stage where just be clean. Safi, oga, bathe every day. Do not skip a bath. Utanuka. For real. Well, if you had a vaginal bath, I recommend you bathe kila siku. You have no excuse. Go. Another thing you should do that I really highly recommend is a sitz bath. There's no shortcut about this. A sitz bath is whereby you immerse half of your body and you sit on a basin that has hot water, not boiling 100 degrees point water, but hot enough water to disinfect down there. and you can put Epsom salt or regular salt. I recommend Epsom salt, but kama huwezi pata, it's fine. Regular salt works perfectly as well. You can use a regular basin or a sitz basin. I recommend you do this for a month every day. You will heal faster, and also it disinfects the area and helps you fight any infection you might have. Another thing that I would like to add, third week, I recommend you to now clean deeper. No, do not insert your finger inside the hole. No. I'm talking about the valves. Like, open them up and clean the folds, because as I said, there is so much discharge coming out, so you need to open the valve and clean them well. Another area that many women forget is the foreskin of the clitoris. Just pull it back a little and clean that area. If you don't have stitches, you can start immediately, but if you have stitches, I recommend you start after 2 weeks. Separate face towels, one for your hoo-ha and one for your body. And also your maji usioge nayo. Ukishakalia, mwaga your maji and take fresh water for the rest of your body, because you have very good time for this kind of thing. Don't be lazy. Just have to. There's no shortcut. You have to do all these things. I will never recommend you to do any exercise. Do not do pelvic floor exercise immediately. You can do the pelvic exercise after 6 weeks. If you do not know the pelvic exercise, okay, I'll just do a separate video for that because of time. I really try to keep my videos short. But one exercise that I recommend you should try and do it from day one or as soon as you feel comfortable is Kegel exercise. Kegel exercise is important. Very important. Very important. You have to do it. You have no choice. So Kegel exercise, let me explain it, how you do it. I wrote a few notes down so that I do not forget. So make sure your bladder is empty, then sit or lie down. Tighten your pelvic floor muscle, hold tight and count 3 to 5 seconds. Do not exceed, and I'll tell you why in a few. Relax the muscle and count 3 to 5 seconds again. So you hold it tight, then count 1, 2, 3, or 1, 2, 3, 4, 5, and then you release, and then you count to 3 again or to 5. Repeat it 10 times, 3 times a day, morning, afternoon, and night. Breathe deeply and relax your body when you're doing these exercises. Make sure you're not tightening your stomach, thigh, buttock, or chest muscles. Whether that is a mistake many people do. Actually, if you do it wrongly, you will end up tightening the wrong muscles, and then when you're having intercourse, it will be so painful. So you have to be careful how you do these Kegel exercises. Once you learn how to do them, do not practice at the same time you urinate more than twice a month. Doing the exercise while you're urinating can weaken your pelvic floor muscle over time and cause damage to your bladder and kidney. And that's the first thing we're avoiding, because Kegel exercise helps to tighten the pelvic, so ndo usikuwe na loose bladder. So if you overdo it, it will do the opposite. It will weaken the pelvic floor and you'll have a very loose bladder. So so if you do not know how to do it, it's like pretending to urinate and then holding it in. So ever pretend you relax and tighten the muscle that control urine flow. It is important to find the right muscle to tighten. Feel the muscle in your vagina or anus. Anus get tight and move up. These are the pelvic floor muscles. If you feel them tighten, you have done the exercise right. Your thighs, buttock muscle, and abdomen should remain relaxed. If you're still not sure you're tightening the right muscles, Imagine that you're trying to keep yourself from passing gas. So insert a finger into your vagina, tighten the muscle as if you're holding in your urine, then let it go. You should feel the muscle tighten and move up and down. Do not rush into having intercourse when your hoo-ha is not yet healed. I know doctors recommend after 2 weeks it is fine, but I feel like you should go longer. That way to give your muscles time to tighten. I'll have someone to come and talk to you guys about it, someone who's married, and they can explain it deeper. Guys, I think that's it for today. If you feel like there's something I haven't talked about, or if you have any questions, you can always leave them down in the comment section. But if you feel like you want a more private one-on-one chat, you can always find me on Instagram. I will link my handle on the description box, so you can DM me. I promise I will answer all your questions. Oh yeah, guys, take care of your hoo-ha. It is very important. To me, it is the most special part of a human body. So I'll end this video here today. I really hope you learned something. As I said, I'm also learning, so if you feel like if I've stated anything wrong, or if I haven't touched on anything, you're free to comment down below. See you guys next Friday. This was Unwinding with Mama Mali.